Hello and welcome to the Education Redefined webcast series, where I uncover educational best practices and share success stories with every single episode. Go ahead, grab a cup of coffee or your favorite drink and enjoy a few moments talking about teaching and learning with me. Hi, my name is Sandy Alakhanpal and I am your host for this series. Subscribe to our webcast or look out for new episodes on YouTube. Join our Facebook group for the latest trends in the field of education. Welcome to this episode of Education Redefined, where the spotlight is on dyslexia. The spotlight this week is on Dr. Anson Koshy. Dr. Koshy is a board-certified developmental and behavioral pediatrician and bioethicist. He completed his fellowship in Developmental and Behavioral Pediatrics at the Children's Hospital of Philadelphia before moving back to his hometown of Houston, Texas. He is the past president of the Houston branch of International Dyslexia Association and has been practicing as a developmental and behavioral pediatrician in the Houston area for the last 8 years, working with children with all types of developmental issues, including autism, spectrum disorder, ADHD, and learning differences. In this episode, he peels the layers of how dyslexia and the information that doctors can supply can be helpful, as well as how to identify gaps and resources available to students with dyslexia. So without further ado, I'd like to welcome Dr. Koshy. Hello, Dr. Koshy. Thank you for taking the time to speak with me and my listeners on the Education Redefined podcast series, which is dedicated to dyslexia.
Thanks so much, Sandhya, for having me. Happy to be here.
Yes, thank you. My very first question before jumping in, I know you have a very deep background in dyslexia and you've been involved in research. What is it that you specialize in, and what is your area of expertise? And how did you chance upon dyslexia as an area of expertise?
Well, I think the chance part is a really good point. So I'll have to come back to that. But I'm
Okay.
a developmental and behavioral pediatrician. And so part of what falls under that scope involves learning disorders. But you're totally right. It was a chance thing that got me really a little bit deeper into things like dyslexia and other learning issues, because we do 4 years. Well, I did 3 years of pediatric residency training, and then we do 3 years of subspecialty fellowship. But even in the fellowship, developmental and behavioral pediatrics, where dyslexia is housed, it isn't like we have this wealth of knowledge from fellowship training. And so I left my fellowship training, and I can tell you it was a common theme for our fellows. And this is a very prestigious #1 children's hospital in the country. We would leave that 3-year fellowship training, and it was a little variable how much we knew about dyslexia. We knew a ton about ADHD. We left there knowing a ton about autism. And so when I moved back to Houston and got my first faculty position out of training, I specifically wanted to work with Dr. Danny Williamson, who is a developmental pediatrician who has absolutely dived deep into dyslexia. So I would say my first 3 years as an actual physician practicing medicine, I also was learning from him everything he knows about dyslexia. And that's really how I kind of realized, wow, I didn't learn as much as I thought I learned about it. And there's still so much more to learn.
Right, right. And that really begs the question is how much do pediatricians know about dyslexia, right? Because that's the first stopping point. When I think of my child, the first stopping point of questions is my pediatrician because she or he is the expert. How much is it do the pediatricians on a regular, like the PCPs as we call them, how much do they know about dyslexia and learning disabilities in your
Yes,
experience?
that's such a good question. And it's a tough one to answer because I think you have pediatricians who are in primary care who are very comfortable around learning issues. But I would say, generally, if we think about what kind of training the general pediatrician has before they are out in practice, that 3 years of pediatric residency, maybe there's one lecture on dyslexia in the 3 years, right? And so it's not like there's a ton of knowledge. Absolutely, some pediatricians dive in and they recognize it. But medicine is so focused, especially in your training, on let's address all those like very critical medical issues. And so development, learning, sadly, often is kind of on the back burner. And that part's not necessarily the case for pediatricians. Pediatricians know a lot about development, but
Hmm.
tackling dyslexia, it's so different. So I think it's a little bit variable, but I would say there's definitely more room to grow.
Okay. Okay. So in your experience, who would be the first go-to person that a parent should go to with questions about dyslexia? If I suspect my child has dyslexia, where's the first stop?
So I would say there's two.
Okay.
One would be your pediatrician, regardless, because I think what's changing is pediatricians are learning more about dyslexia. When I was involved in the residency training, we incorporated a lecture that related to dyslexia that's actually geared for parents, but we want to kind of incorporate it into trainees. So I think pediatrician is still a great place to go because the word is getting out there. I think there's a shift hopefully happening where there's a little bit more focus on how do we support families who have children with these learning issues. But then the second is the teacher. I am always dependent on teachers, and they tend to see a lot of things, not always, but I think it's a very well-informed teacher can be obviously a parent's really important asset to work with.
Okay, okay. And that's also because they see them for a couple hours and they get the comparison point from the years of experience, and this is what is normally expected at this age group, right? Um, there's a lot of theory about, and there's so many questions that are popping in my head, but there's a lot of theory about delaying testing, like for dyslexia. A lot of times you hear, let's wait until second grade because they might still developmentally may not be ready. But then from a diagnostician's perspective, they can actually test at age 4. What do you
Yes.
think is the sweet spot? Because you want that early intervention, early identification.
So I do love that Texas is kind of screening more at the end of kindergarten and first grade. I know COVID messed that up for the first year, but I love that time period because there are signs there that we don't want to miss because of the early intervention component. I think there's always a shift. I think pediatricians, for almost everything developmental wise, they'll say, let's wait and watch, let's wait and watch. But I think with the messaging we have, that early intervention for everything related to learning and development, the sooner the diagnosis, the better. And you're right. I mean, diagnosing a child in kindergarten or maybe even before that, even if it's still questionable, it doesn't mean you can't intervene. And there's not,
Right.
and there are things parents can do to help. So I'm a big fan of that earliest diagnosis, which I think kindergarten, first grade is a good place to be.
Awesome, awesome. And if you think about it, autism is generally identified sooner than dyslexia. I mean, you they are still in preschool and they start getting interventions. So from that perspective, if I were to draw a parallel, I should be able to get the same level of testing and intervention with dyslexia. Now,
Yeah.
dyslexia tends to get clubbed with learning disabilities, and learning disabilities are on such a broad spectrum, right? There are so many specifics under that one umbrella. Can you define for me what is a learning disability and how does it differ from dyslexia? What are some of the signs that parents should be looking at if they suspect dyslexia?
So I think one way to think about learning disabilities is it's kind of the old school model of, okay, well, where is someone's potential? Meaning, where is their cognitive skills or IQ? And then where are they performing academically, literally in any subject? And if there's a discrepancy between someone who has an average to above average IQ, but we're testing them and their actual performance academically is well below that, that discrepancy model is a great way to think about learning disabilities. Like we know this child is not meeting their potential. So how do we sort that out? And so in that mix, it could be dyslexia, but there could be other things like a math related learning disability. So I think that's a really good way to think about it. But when we think about dyslexia, it's kind of a language based learning difference. So
Okay.
it's always good. Like my goal in life is to hopefully help pediatricians understand there are just some simple questions you can ask just to raise that concern of potentially dyslexia, which I think those are things your listeners are probably very familiar with and you've covered a million times. But what's interesting is pediatricians don't ask that typically.
Right, right. I think there's a lot of, as much as there's awareness, there's also a lot of misconceptions, right? Because a lot of times you'd get parents saying, well, he doesn't reverse letters, he doesn't interchange letters, so he might not have dyslexia, which might not be true, right? That's just one symptom. There are so many other symptoms to watch out for, which I'm sure from your research, you're very familiar. There's an entire spectrum of symptoms that we look for when we say we want to test for? Can you quickly go over some of the symptoms that you generally see?
Yeah, so that reversing letters is so common. I hear that all the time, even for kids who have autism. We know that they'll reverse letters in writing. So it's definitely not specific to dyslexia. And it's actually not one of the things that I would ask for. But I do know it can happen. So
Okay.
the things that I'm looking for is family history. I mean, literally, there can be a wide range of abilities in a family. And so maybe someone who had very, very mild dyslexia, but who functions just fine as an adult, maybe their child has more significant issues there. So family history is one. I always want to know about that. I also want to know about language delay because you're right, when it comes to autism, there are certain things we can look for in very young children, but the reason it makes it harder to diagnose dyslexia is because now we're learning how to read and we're not really equipped to do that until you're a little bit older. With autism, we can pick that up at a much younger age because it's a lot of play-based social interaction.
Right.
But thinking of dyslexia as a language-based issue, it kind of tells you, okay, so if I have a patient who has a history of language delay, and they're getting speech therapy, and there's a family history of dyslexia, and then I want to know when parents are working with their kids, does your child have a hard time pairing the phoneme or the sound of the letter with the letter when they see it? Or can they give me rhyming words? Tell me a word that rhymes with star, tell me a word that rhymes with stop. Those are the type of questions that if I get those questions and all of them are yes, 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 I'm like, okay, we need to talk about how do we get testing, at least put it on the table as something to consider.
Okay. Going along with myths, there's one more myth that I want to clarify that
Yes.
people who are who have dyslexia, they tend to use one side of the brain, which is the non-linguistic side of the brain. Is that true?
So I think the way to think about it is there is a part of like three parts of the brain that have to kind of communicate seamlessly for us to learn how to read, because we're not born with that. We are actually co-opting parts of our brain to like teach us how to read. And so when someone is struggling with that, that is one specific side of the brain that is kind of doing that functioning. But I think what you're getting at is that a lot of people with dyslexia have other strengths, and so kind of that problem solving, kind of thinking out of the box component, it's kind of like a little bit different than a much more analytical way of thinking. And so that may be what you're describing.
Yeah,
So that's how I look at it.
one of the things in my conversation with people about dyslexia, one of the things that I hear is that the parts of the brain that need to function together for us to learn how to read and write and associate sounds with letters, that is lower functioning than what you and this might be a complete misconception, but we can, through therapy, train the brain to
Yes.
use those lesser utilized parts of the brain. And
Yes.
is that true, or is that a complete myth?
No, that's totally true. So that's what the functional MRI imaging out of Yale, the Shawitzes were the kind of the first people kind of getting all of that research done. That's what's so cool about dyslexia is we know so much about the neurobiology of it, unlike every other kind of condition in my world, at least.
Mhm.
And so it's true for people who have dyslexia, when they're trying to do those things like reading or word association, when they're in the functional MRI, the parts of the brain that we expect to light up don't, or they light up in a very small amount. But we know with structured literacy, kind of very evidence-based intervention, over time, you start to see those parts of the brain that we want to light up that actually increases. So it's kind of like we see this very cool imaging of the brain, like a pre and a post that's showing, wow, this looks completely different. So it is true that you see those parts of the brain kind of get remediated and kind of expand in how they're functioning.
Okay, okay. And I want to come back to that question. I'm going to hold off on that for just a
Okay.
minute. So there are two ends of the spectrum. So of course, dyslexia is from mild to moderate, right?
Mm-hmm.
It's on a spectrum. And I have seen that people with therapy, structured therapy, who don't progress. And a lot of times when they don't progress, we start looking for other coexisting conditions, right? So you've got ADD, ADHD, you've got dysgraphia, dyscalculia, and there's a whole list.
Yeah.
Um, how true is that? Like how much and how can we remediate for those components for therapy to be able to work? And then on the
Yeah.
other end, this is a two-part question. On the other end, there are kids who compensate really, really well, who have dyslexia, but it's so mild that they're able to compensate. And they're sometimes even dual qualified in the sense that they might have gifted talented in
Mhm.
addition to the dyslexic qualification.
Yeah.
So how do you balance the two ends? How do you pull the parts out?
Yeah, I love how you say it's all in a spectrum because I think the same way for almost everything. You know, we say autism is a spectrum
Right.
formally, but literally I feel like everything else in life is a spectrum. And so the way to think about it is um, my take is that first assessment, which is why I think it's so painful when we see our patients or students having to spend half a day getting all this testing done to kind of make an assessment of is it dyslexia, is it not, are there other co-occurring issues? That first assessment is key because, and I think that's the pressure I feel as a developmental pediatrician. If I'm not equipped to make sure I'm seeing everything, I don't want to just say it's ADHD. I don't want to say it's just dyslexia. The suspicion should be very high that there are multiple things going on. And then if we don't see them, awesome. So it really comes down to that initial assessment first. And then if you're
Okay.
right, if someone is getting all the right interventions, they're kind of getting that tutoring program, they're not making as much progress, then it is important to kind of revisit, like, is there anything else going on? Things like ADHD. And so part of a research project I was involved with at UT looked at that. We were looking at children who had been diagnosed with dyslexia and ADHD. And so, and that's such a common question I get from parents is like, okay, my child's not making enough progress with reading, or maybe he's not doing tutoring, but we know he has dyslexia. Can we just go ahead and treat his ADHD and will that help the dyslexia? And the
Hmm.
study basically found out that we have to treat everything individually. So
Okay.
if we have a patient who has ADHD and also dyslexia, it's not just that, okay, well, let's treat the ADHD and now you're going to see all this progress with improvement with reading. It's not necessarily the case. You have to actually treat each thing separately.
Okay.
And so that's a really important way to think about it. It doesn't mean it's always something is the most pronounced. I have patients who have anxiety and ADHD and dyslexia. And
Oh, wow.
sometimes there's this interchange of sometimes the anxiety is a bigger issue, sometimes the ADHD is a bigger issue. So it's kind of that constant monitoring and making sure you have kind of all the pieces there.
Right. It's interesting how you said treated everything individually because you hear different. When you speak to somebody who is an academician or somebody in school, they'll say, oh, well, he's lagging behind because he has a coexisting ADHD condition. And if you were just to medicate him, and that would fix everything. So that, in your
Yeah.
opinion, is not, it might not be true.
No, and that's the question because we hear it all the time, and I hear it from parents. And so, so far in the literature and the studies that have been done, it shows that you have to treat each thing individually. I can appreciate why, though, if I'm a cult working with a student who has dyslexia and ADHD, and he or she is not taking, say, ADHD medication. Not that
Hmm.
I'm advocating for that,
Hmm.
but I could see why. Like, if someone with ADHD, you can think like, oh, wow, you're really not focused right now. You're not really picking up what I'm learning. But if we treat the ADHD, it doesn't necessarily mean you're going to see this dramatic improvement in the reading progress.
Okay. So
Yeah.
then that's when parents start to push back on is medication really necessary? Because a lot of times you see kids who look like zombies after they are medicated, and that's,
Yeah,
fair enough. I would be doubtful as a parent too. Why should I medicate if it's not a cause and effect situation, it's not going to
absolutely.
help my child academically, then why should I have him walk around drugged all the time? So
Yeah.
in your opinion, what can be done then? I mean, if it is not a direct connection between the other coexisting condition, what can we do to make these kids successful with the therapy that they're getting?
Yeah. So one way to think about it is so like what they did in the study is they retested everybody and did measures from teachers and parents, kind of if they were treated with medication, if they got both medication and tutoring, or if they only got the tutoring. And so on those outcome measures, there was no dramatic difference. It doesn't mean that there's not some potential gains. I just think that's one way to keep that in mind. You mentioned something about medication. And so I totally agree with you. If the parent is seeing a child on ADHD medication and they have this kind of flattened affect where they're not as kind of emotional as they would be or as animated as they would be, it just means it's not the right medication. So
Okay.
so I think that's really, really important because I think whenever I've had conversations with parents about medication, I always tell them, look, this is a big deal. This is not a simple decision. But we know what we're looking for when it comes to side effects, and we know what we don't want to see. And so that flattened affect, kind of what you reference as that zombie effect, to me, it just says, wow, that's not the right medicine, not the right dose. And so I'm a big fan of giving parents all their options. I'm not a big fan of pushing one thing or another. And I think families have to make their own decisions when it comes to that. But there are so many patients I've had and that I've worked with who never had that effect, because if we saw it, we knew we needed to change the medication. And so I think that's really good to kind of put out there.
Okay. Let me take you to the other end of the spectrum where we
Yes.
find the higher functioning kids with dyslexia.
Yeah.
And I've had personally, as a teacher, I've had an experience where there was a really high functioning kid. He was identified, qualified for dyslexia services, and his parents, for lack of a better term, because of
Mm,
stigma and peer pressure, did not want him to get those services. He was
yeah.
compensating really well. He was dual qualified as GT. So, what would you say to parents of kids who are dual qualified? Is it good to not go with therapy? Do you suspect that the gap is going to become wider as he or she goes into middle school? Or is it okay to let them compensate because they are higher functioning and dyslexia is mild?
So I just think one of the things that I think is like a very interesting trend is we see a lot of anxiety in kids, right? COVID made that worse. I think everyone
Definitely.
globally has had a lot of anxiety, but I always worry about the high functioning children who can compensate, because it means they are working very hard. Like,
Mhm.
and that effort that goes in, it can manifest in other things like anxiety at home, other more challenging behaviors at home. I always tell families, when parents are talking about their child, who's my patient, and they're saying, he or she comes home and they're just not in a good mood. And I was like, well, they're probably working very hard, especially these high functioning kids.
Right.
And I'm like, of course they're going to be cranky when they get home. If my best behavior is in the office, when I get home, I'm cranky. Who's not? I mean, that's
Right.
where we tend to show those behaviors. So those are the types of things that I always put on parents' radar, that it's a family decision. It depends kind of how if there's other things going on. But sometimes those very kind of what may be viewed as minor accommodations can literally decrease the stress a child is experiencing at school, that can then channel into like better attitude related to homework, more improved social interactions with everybody. So I
Right.
think it's if we kind of have to sometimes think about it outside of the academic component, because those kids who can overcompensate, wow, well, what if we could decrease their stress level and then they could still perform the same way? Then maybe they would be excelling in other areas that are currently a challenge for them.
Right, right. So parents should really be looking out for how is it manifesting, right? If the pressure is too much on the child, then maybe give those interventions and relieve some of that pressure. That's what I'm hearing.
Absolutely.
Yeah.
Absolutely. And it's really important depending on how old the child is, because a lot of older kids, they don't want to feel different. And
Right,
so if it's stressful for them and they're like, I really don't want to do it, I think it's important to take that into account.
right, right. So when a child gets therapy, from a pediatrician's perspective, what is the normal growth curve that you see if therapy is successful and the structured approach is working?
So that's a good one, because I think in general, pediatricians aren't going to get that information. And I can guarantee you, I don't think they would know what to do if the tutoring wasn't working.
Okay.
And so I think from my perspective, it's all over the place. I've seen patients who do really well with therapy, who then don't really need it. I've seen kids who need it pretty consistently for a very long period of time. So it's very individualized. And so I'm often in those instances when parents are trying to ask, like, well, what should we expect? It's kind of getting as much information as possible from either the cult or whoever is working with him, whether it's a different type of tutor, and tracking progress over time. And so that tends to be where you get a better idea of how a child is doing. It's very hard to make a blanket statement, because I can just think of like 5 different kids and they all look completely different when it comes to dyslexia.
Right, right. So if I'm hearing you correctly, that the certified academic language therapist is the correct source of information that you should be depending on in terms of how much is my child progressing.
Yeah, if that's a resource that as a family you have access to, which is a whole nother issue. But yeah, if it's this person at school who's doing the similar intervention, because they're the ones that are tracking that progress, because that really important, individualized, highly kind of intense structured program is unique for each kid, and the person who knows that the best and how they're adapting would be the person providing the instruction.
Okay. I'm going to circle back to that identification piece. What are some of the questions that parents should be asking their pediatrician or their teachers if they suspect dyslexia? Because a lot of times it boils down to asking the right questions to the
Yeah.
right person.
Yeah. So I think if parents are concerned about dyslexia, it's important to get information from the school, depending on the age, whether this is what the teacher told me, and write it down.
Okay.
Because sometimes teachers will use terminology that as a parent, you're not supposed to know, but you just write it down. And share that information directly with your pediatrician, because as a developmental pediatrician, I usually have more time than the general pediatrician. And even I don't have the time to try to get the teacher on the phone because I never can get them at the right time.
Right.
So if you're able to kind of serve as kind of the go-between and be like, this is what the teacher is describing, and
Mhm.
this is what we used to do. Sometimes you have to literally have that kind of serve as that like middle person to give the pediatrician like what is it that the teacher's saying. And so I think thinking about like, when am I worried? When should I be expecting testing from the school? Or what are my rights? Or how do I initiate a request from the school to do an evaluation? Those are things the pediatrician can definitely help with.
Okay.
In Houston, we have a lot of resources, which I don't think every other city has. So we're very fortunate. And so I'm hoping centers like NIHouse are
Yes.
on pediatricians' radar so they can say, hey, there's a great, you know, talk that they do monthly at NIHouse. And so kind of directing families to those services. But, sometimes the pediatrician doesn't have the time to do that. So that would be a great way to connect them to getting more information,
Right.
which I think is generally what pediatricians would be doing because they're not going to be doing the testing,
Right.
and they may suspect a learning issue, but I often think it's coming from either the parent or the teacher that's prompting it.
Right, right. You mentioned that you obviously you have a specialization, right? You have that developmental pediatrician,
Mhm.
that niche. How does one get access to you? Because it's gonna on a regular basis, I wouldn't be dealing with you. I would be dealing with a general pediatrician.
Yes, and so I think that's the problem because there are so few of us. I mean, in where I was working at UT, I was really the only developmental and behavioral pediatrician, and so that is just impossible to sustain. And parents couldn't have access to me because we were really focused a lot in our clinic on autism, and
Hmm.
so when it comes to dyslexia, it's the idea of like you have to talk to your pediatrician, and they can then connect you to a specialist, whether it's me, whether it's a psychologist, whether it's another provider. And so it is difficult to access someone on my end.
Right,
And it's just unfortunately part of kind of the challenge of my specialty.
right, right.
Yeah.
Yeah, that's unfortunate. I wish we would have more of you.
Trust me, I'm trying. I get every medical student and pediatric resident. I try to tell them all the awesome things about this field.
Yes,
And we
yes.
got a few more coming along in the pipeline. So
Yeah, it's definitely a niche, and you kind of fall. A lot of people who are interested kind of fall into it. They've had a brush by accident, and then they kind of get intrigued by it. Um,
absolutely.
Dr. Koshy, thank you so much for taking the time to speak with me. If you don't mind, I would put your contact information in the podcast notes, and
Mhm.
not that you want to be flooded with emails and questions, but maybe they can reach out to to your office for general information and go from there. But I
Sure.
really, truly appreciate the time this evening.
Oh, awesome. I appreciate what you're doing. I think it's so important to get this information out there. I think, stigma, you mentioned it really briefly. I think stigma when it comes to learning issues or other mental health issues, the way we can get rid of it is having conversations like this and kind of normalizing that, it's good to be different. It's not
Right,
necessarily a bad thing. And if there are ways that we can help parents understand how to support their kids, I can't think of a single parent who would say no to that. So
right,
sometimes
right.
that's with the diagnosis and sometimes it's without. But I love
Yeah.
what you're doing. I think this is great.
Yes, yes. And I think every child's different. They all learn differently. Everybody has their strengths and weaknesses, and we learn to
Absolutely.
compensate, and dyslexia is no different. So
Absolutely.
thank you for peeling another layer on dyslexia this evening. I really enjoyed the conversation.
Awesome. Thank you so much.
Thank you for listening to this episode of Education Redefined. We welcome feedback. Join our Facebook group to leave a comment or a question. We look forward to hearing from you. Until then, stay tuned for our next episode.